someone realizes the power that's been represented on this conference today and realizes the power in that activation for us collectively as we really think about our path forward in addressing social needs navigation. So I definitely realize that those challenges are real, but I also realize that what this group represents is perseverance. And so as we really begin to think about, our path forward, what I really wanted to share with you is this image that does not want to show up. And what it actually was, for whatever reason, is not showing. Um, Zoom keeps stopping my screen share. But needless to say, what I was going to share with you was actually an image. And if you could just think about a plate of spaghetti, right? And so when we think about everything that we've heard today, we're probably saying ourselves, oh my God, where do we start? Where do you begin? When we start thinking about these social determinants of health and the various social needs caused by them, when you think about that plate of spaghetti, don't just think about it as an opportunity or it's so much to go on, we don't know where to start. Just think about all the delicious and inviting bites that you will get with every spoonful of spaghetti. The next one won't be like the last one. So when we think about our experience and our opportunities to address the social determinants of health, really calling to the forefront that we have a really unique opportunity before us to really engage with folks along their healthcare journey in a way that we've never done before. We cannot ignore the fact that a fragmented healthcare system is the consequence of we cannot ignore the fact that a fragmented healthcare system is the consequence of historic policies that have not focused on achieving health equity, but were designed on the foundation of systemic racism and the underpinning policy. We have to understand, as Becky pointed out, policy is what really brought us here. Dr. Wynn pointed out early in his presentation some of the historical policies where it was the housing policy of FHA housing policy, but policy is also an opportunity for us to drive us forward, to really drive us forward in dismantling the systems that continue to perpetuate the allocation of resources, including healthcare, in a way that we know continues to exacerbate disparities. So as we think about addressing health equity, we must understand that it is so foundational to social justice. As we think about our path forward, we must acknowledge that a right to healthcare is very different than a right to health. And as Gwen pointed out in her remarks, it's not about either or, but it's really about both and. And as one of our attendees noted, we must pull back the veil. We must pull back this veil of systemic racism, this veil of inequities. But I challenge us to not only pull it back, but once we pull it back, pull it down. Because we must pull down the structures of inequity that continue to result in poor health outcome and extinguish the voices of all patients, especially those who we know voices have been simple echoes in the wind. What we see playing out before our eyes are the experience of racial, ethnic, and geographic disparities. It's not about biological predisposition, but it's actually the result of intentional power dynamics at play that position some at the top and others at the bottom, causing the structural and economic predispositions experienced by the populations that we're all trying desperately to support. So let's not act like we're surprised by what the system has accomplished, because as Meg pointed out, the system is accomplishing what the system is designed to accomplish. So let's not forget that people add value. It's so important for us to think about the fact that it's other disciplines that will really help to inform the healthcare experience. And it's important for them to understand the patient experience. As one pointed out, it's just as important for the designer of the EHR to understand the patient experience as it is that front desk person and all points in between. When we think about each one's experience, we continue to think about individuals as silos. As Matt pointed out, they're air traffic controllers. I thought that was a beautiful analogy. And they're really trying to navigate all the planes that are part of their healthcare life, and they're trying to keep them all from crashing. What we have to also keep in mind, but for so many under-resourced, limited resource, marginalized, vulnerable population, they're not only balancing all these airplanes, They're balancing their own mini pandemics that are occurring at the same time, whether they be housing insecurity, food insecurity, economic insecurity. So, what do we really do? We have to understand that the social needs that we're talking about today, that they can erect at any time along someone's healthcare journey. Many of us have experienced the financial burden of healthcare, whether trying to navigate the system, understanding a diagnosis, or foregoing other cost of living expenses just to think about care, or just to be able to adhere to care. So we have to understand that financial burden of healthcare cannot be understated. The impact on patients living with chronic conditions and their caregiver is real. And oftentimes, as Matt pointed out, they're trying to navigate it all. That should not be. How can we do different? How can we make the health experience different for individuals? We do that by establishing social needs navigation as a standard of care. This is an opportunity to help patients navigate the complexities of the administrative elements of their healthcare journey. Navigation work is real and is a vital resource for helping individuals understand not only insurance, but understand the complexities of healthcare. Let's be very clear. There is a role for the healthcare system in mitigating financial distress. Conversations around cost should be happening at the same time as treatment. Can we explore flexible financing options? Financial and social factors are often discussed last as if they're not critical to the context of healthcare decisions. So, what are our actions? What do we do next? So, this is just a list of a generated call to action. And for the sake of time, I won't go through it, but really want to drive your attention to this opportunity that social needs navigation affords us. It's an opportunity for all of us to really be able to elevate the need for, the benefits of, and the opportunities to really integrate social needs navigation as a standard of care. People should not have to find out about resources by default. We have to be intentional. The time is now for us to have a different conversation, to take different actions, to be intentional in addressing the social determinants of health, and more specifically, the social needs that are caused by them. Next slide. So since Dr. went open with a space story, I will close with one. Don't tell me that the sky is the limit when I've seen footprints on the moon. As an attendee shared in the chat, we must use our collective voice to demand change. The first moon mission didn't happen without the mathematician, the scientist, the statistician, the engineer, the designer, the field operators, and hope, that one thing that we keep in the secret little place in our hearts. Normalizing needs navigation will require all of us. Let's mobilize and let's activate together.